Michael, thank you so much for taking the time with me. I'm excited to hear what's next for Everyplace Labs. You know, we've had a chance to talk a couple times, and it's really exciting to see how you're upgrading the way that people get point of care testing. So walk me through what Everyplace Labs is.
Thanks, Logan. Thanks for having me. Looking forward to sharing. So at Everyplace Labs, we're developing a self-service diagnostic kiosk for essential work sites and community settings. Our kiosk, it automates testing and the processes that surround on-site testing operations. So it produces point-of-care test results for patients in about 15 minutes, and it also makes the point-of-care testing operations very hands-off for employers. So it handles conversion of medical waste into municipal waste. It keeps the testing environment hygienic. It self-sanitizes itself after each patient usage, and also stores and distributes test kits to the right patient at the right time.
Okay, so let's break down the challenge first. Let's talk about kind of what was broken in point of care testing or just at home testing that really lets you know that there was a gap here in the market.
Yeah, so the challenge is, so we're focused on the essential worksite market where, essential workers like manufacturing plant workers, they have very demanding work schedules. They're working 12-hour shifts a day with only 2 20-minute breaks and 30-minute lunch break in between. And so because of this, they don't have enough time during the workday to leave the worksite to get tested. And after work, they have little personal time left over to seek health care. So essential workers, they're looking for diagnostic solutions that are on site where they are at work, so it has minimal interference with their personal time. And so that's from the employee's perspective. From the employer's perspective, human resource leaders, they want to implement diagnostic testing to improve employee safety and employee health, but they face 2 key constraints. The first constraint is they want to make sure it doesn't interfere with the productivity and the workday of their employees. So manufacturing lines, they're often dependent on each other, and if a few employees are missing in one manufacturing line, that can cause the whole production plant to shut down for significant hours during the day. So human resource leaders, they want testing to be on site as well, where it minimizes that impact on productivity. The second constraint is, HR leaders, their main job is to hire and retain the best talent. It's not to operate a testing site. So they're looking for turnkey solutions that's very hands-off, that they don't need to manage on a daily basis. They don't want to be distributing test kits, proctoring tests, answering employee questions, keeping the environment clean, and handling regulated medical waste. But to do that today, they had to hire clinicians to come on site to operate the testing site for them, which is very expensive.
What I hear you saying is these essential work sites, these large manufacturers are dealing with thousands and thousands of people, and when it comes to understanding who has the flu, who has COVID, who has this or that, they're really operating in the dark. They're saying, go take your own time, go to the CVS, go figure it out, or they're running their own little clinic that they're not really set up to do. And so this makes it a turnkey solution. So let's talk about the experience of it from the point of view of an employee. I understand that you're in a pilot right now.
Yeah.
Tell me about that.
We have 2 pilot partners right now. The first is Nemera. They're a global medical device company headquartered in France, and they have a 430-employee manufacturing plant in the Chicago area. And our second pilot partner is MHub. They're a manufacturing innovation center in the Chicago area. And so we're piloting our beta system to demonstrate its usability at these 2 pilot sites. And then later this year, we'll be performing a clinical trial with a community health clinic, likely in the Boston area, that serves people experiencing homelessness. Yeah.
So let's say that I'm a worker in the manufacturing plant in Chicago, and I have flu-like symptoms while on the job. So walk me through what my experience might be like.
Yeah, so you may have a cough at work, and you may wonder to yourself, is this just allergies, or is it flu, is it COVID? So you could find out really quickly, only spend about 5 minutes of active time. So you would start off by filling out an online questionnaire, filling in your symptoms. And based upon your symptoms and your location, you're directed to a nearby Everyplace Labs kiosk, which is at your office in a private conference or private office room. And so you'll receive a QR code on your phone. And so you would go to the room and go to the kiosk, and then you simply scan the QR code on the kiosk. And based upon the information there, the kiosk will dispense a self-testing kit. And then the kiosk has instructions on the screen that guide you through how to self-test yourself. And it's a really simple process. You're simply collecting your sample, and then placing the sample into a cartridge, and then inserting a cartridge into the kiosk. And from there, you can walk away, and the kiosk automates the rest of the testing process inside. And you'll receive results in about 15 minutes. And so because of this, you're really only spending about 5 minutes of your time.
So it's a lot more than just a vending machine for the test. There's a component to this where you're processing the test inside. Why is that an important piece of this puzzle?
Yeah, so we're processing the manual steps that take place today either in a clinic or in a home. There's a number of manual steps that can lead to human error. As example,
I've done it with a COVID test.
Right,
having to dropper the solution and obviously potential for human error there.
Right, exactly. Yeah, this involves mixing the reagent with the sample, dropping the right volume of the mixed sample onto the test strip, and then visually interpreting the test strip with your own eyes at the right time point. So there's a lot of opportunity for subjectivity and error in that process, and we're making it objective and very consistent every time.
What is the process like for validating that piece of the technology?
So there's a two-step process. The first is experiments in the lab, which we've done. So we've conducted analytical studies where we compared our alpha prototype against the BD Verida reader. It's a major point-of-care reader often found in doctor offices for point-of-care testing for flu and COVID. And our alpha prototype, it's our core analysis engine that automates the point-of-care diagnostic process. And in these studies, we found that our alpha prototype had a better accuracy than the BD reader for both flu and COVID. And it has a better limit of detection, so it can detect lower viral concentrations more consistently than the BD reader can. So that's the first step. The second step is validating these results in the real world. So later this year, in a few months, we'll be conducting a clinical trial at a community health clinic where symptomatic patients for COVID will use our kiosk, and we'll be comparing our results with PCR results in the lab to validate the real world sensitivity and specificity.
When I think about Everyplace Labs, I think about access to care, and I think about bringing really essential healthcare services to places that really lacked it in the past, and how it's this, like you said, turnkey solution. How do you think about going beyond manufacturers and bringing it into the community and the effect that could have?
So we've been receiving good interest from community health clinics that serve people experiencing homelessness and people from low income backgrounds. So I think it creates what we're doing a lot will make diagnostics a lot more accessible for them in a way that's also very reliable and with a very low cost. We conduct, in our pilot with Nemera, we conducted a consumer survey with the manufacturing plant workers, and we found that the two things they care about the most is that that they have confidence that the test was performed correctly and that the test has a low cost. So the solutions in the market right now typically give one or the other. So if you go to a healthcare provider, you get that confidence it was done correctly, but it's a high cost. With at-home testing, you get a low cost, but you may not feel that confidence you performed the test correctly. And so we're providing both of these benefits, but with the automated solution that I believe will really serve the underserved populations today.
Michael, this is very exciting. I appreciate you taking the time to explain it to me. I think that you're really going to be able to open up access to care for a lot of people through this, and it's a really novel concept. So
thank you, Logan.
I'm excited to watch where you grow in the next year or two.
Really appreciate that.
All right, thanks, Michael.
Yeah, thanks, Logan.